My name is Daisy and I had a PRP injection. I was on my way to work and I was at a stoplight next to a semi-truck and a car came out of nowhere and rear-ended me, first hit the truck and then still managed to hit me and push me into the intersection. I had a lot of pain. I had pain in my face, my back, my shoulder, my legs, everything.
Are you okay, Daisy?
We tried another procedure, but it didn't work, so we decided to do PRP, and that one was more effective and worked way better. With the previous procedure, I got like a 30-40% of improvement, and once we tried the PRP, I got like a 60%, 70% improvement. It was way better.
This morning we're at the surgery center doing some procedures on patients with ongoing spine pain, extremity pain. The last lady we did had back pain and ridiculous symptoms. We just did an epidural, shows the needle in. We obtained x-rays in our fluoro machine and put some dye documenting that we were at the level where she has the problem. You can see that disc is collapsed and we think that's where the pain is coming from. So we're targeting the injection in that area. The next lady that we're going to be doing is the lady's had a lower back injury, persistent pain, not resolving with therapy and medication, and then we decided to do an intradiscal PRP injection on her. So we'll be bringing her here shortly. We've already obtained her blood and we're going to centrifuge it in our centrifuge, and then she's going to be here, going to be sedated. We'll put her asleep first, and then while she's asleep, I place the needles in and make sure they're properly positioned. Then we wake her up because we do a part of the procedure called the discography. When we inject, I ask her how intense the pain is. We're seeing if this reproduces her pain. We'll ask her if this is very similar to the pain she had before. We can observe the disc pattern on injecting the dye, and once we've accomplished that, then her PRP or platelet-rich plasma is ready. We'll inject some into the disc, and I usually inject a small amount around the disc as well to help promote healing. We got an MRI of her, and you can see there's a disc damage and abnormal disc here with a herniation at L5S1. That's the lowest disc in the back, and so we have the MRI present when we do the procedure to make sure that the needle and the injection is done in the proper disc. These are initially the blood is drawn. We're using the BTI system, and then this shows we basically, once we centrifuge, we've gotten the blood, and then the most desirable part of the PRP is directly above that red layer. That's where we're going to aspirate and use that for our PRP injection into the disc itself. The disc really needs a very small amount. There's not a lot of space, so we inject a small amount. And if I have any extra, I usually inject it around the disc itself to promote healing of the disc itself. Do the timeout.
Yes, timeout. This is Miss Gomez Stacy. She's 22 years old. She has no allergies, and she's here for lumbar discography with intradiscal platelet-rich plasma injection. So Dr. Moheimani, does everyone agree?
Agreed. We just did Daisy's PRP injection. She's down in the recovery room, just waking up a little bit. How are you doing? Good. Yeah, how's your pain level right now? Still a lot. Yeah, normally as we warned you the first week or so is going to be an increase from what you had, and then over the next several weeks the pain will gradually drop off, and hopefully it'll be better than what we started. When we did your procedure, you won't remember, but we injected the disc and you said the pain level was 10, so we kind of know when her pain level was 10 that that's probably the disc. And then there was a tear of the ligament. We could actually see that when we injected dye, so it was like kind of leaking, and I think that's where the problem is with the tear of the ligament. You're very young, so likely this tear is caused by an accident, I would think, because you normally have a tear at your young age, so, and a disc. But we're hoping that this injection will help promote healing of the disc. So when you go home, just put some ice packs on it. Again, use Tylenol, extra strength. I think we gave you some tramadol, right, for for pain. And then, but don't, again, as a reminder, don't use any Motrin, aspirin, meloxicam, those things, because there's blockade. You have any questions for me at all? Or?
So just Tylenol, right?
Yeah, the best is the tramadol or the just Tylenol extra strength.
Okay.
And then just maybe if you get sore, a little bit of an ice pack in that area will help.
What about like the icy hot?
I wouldn't use icy hot immediately. I would just use pure ice
Just
initially,
ice?
right?
Okay.
Just pure ice. First couple of days. After that, you can do whatever feels good. Okay, we're back this morning with Daisy. We've been treating her for her lower back injury for quite some time now, and she'd received therapy initially, and then we did facet blocks on you, correct, in April, and she didn't really get much relief. We used cortisone at that point. Facet block is injecting the joints or facets in her back. So as she was not improving, I recommended that we do a PRP injection for her disc. This is called intradiscal PRP, where we actually put the needle into the disc and then obtain her blood, process it, and harvest the platelets, which are injected in the disc, which can help promote healing and reduce inflammation. That was done on June 29th at the surgery center. This is her second visit. So how are you doing this morning?
I'm doing better.
Okay, good. So tell me about the level of pain relief that you've had after the procedure.
I had more relief with this procedure done.
Than you did before. And you said you had about, what, 50 to 60% reduction at this point? Okay. So she had about 50, 60% reduction. We tell people that initially the pain increases after the injection for maybe a week or two. Was that kind of your experience or not really?
Probably just like the first couple of days.
Couple of days. And then you should note improvement. The improvement really is best at around 6 weeks, which we're right now, and then it should continue to get better for several months. Now, if the pain starts increasing again, I would probably recommend doing it a second time, hoping to get a little bit better relief. We can do it up to 3 times, but many patients have found we don't really need to do it. And also, you were having pain in your leg, correct, before?
Yeah, just a little bit.
And are you having that now? Or no, that's gone too. So that's a positive result. So let me just do a quick exam. Let me have you lay down on your back. I'll do a straight leg raising test on you. So we're going to have her lay down on our exam table, and I'm going to lift the leg straight up. Does that cause any pain at all or not? Yeah. And then bending your hip up, relax, and bending across and moving it. Is that painful at all?
A little bit.
So she has some pain with motion of her hip on the right side, and then we're going to lift the left leg up. Do you have any pain with that? And then we're going to move your hip around. Any pain with that? No pain with the left hip. And then let me just look at your back really quick, if I can have you stand up for me, please. So just looking at your back and pushing on it, is there any soreness or tenderness if I push on your back at all? Or not at all. And then let's see how well you're moving now that we did the injection. Go ahead and try to bend forward and try to touch your toe. So she does a good at least 50 degrees of bending of her back, and then bend backwards, and she's going a good 20 degrees backwards, and then bend sideways for me as far as you can go, and then the other way. So she's bending well normally to sides, and then how about twisting your back and the other. So those are pretty normal. Also, any pain with any of those movements at all?
Just bending forward and leaning to the right.
So you had some pain this way. So she had some pain with bending forward and to the right. So at this point, we would encourage you to try to exercise and increase your activity. Again, the best exercise are swimming or bicycling. We told you not to take non-steroidals for 6 weeks, but you can start them now. But if we decide to do a second one, then you would want to go off it again. Any concerns or anything at this point? Or? Okay, very good. And you're working, correct?
No,
or you're not working currently?
No.
Okay. Okay, very good. Okay, so right now we'll kind of leave it open as far as an appointment. We'll kind of put down that, we may do a second one. You can think about it and let us know if you would want to do that at some point or not.